Ophthalmic migraine with aura. How to get rid of it. Migraines with visual aura, commonly called ophthalmic migraines, sensitive or phasic, are manifested by the appearance of neurological symptoms before the migraine headache. These may be bright white spots, tingling or speech disturbances. When to consult. What treatments to consider. Definition. In France, approximately 1 in 5 adults suffers from migraine, with a clear female predominance. Women are 3 times more affected than men. This neurological disease results in attacks of violent headaches, called headaches, recurrent. A distinction is made between migraines without aura 80% of attacks and migraines with aura 20%, for which visual, sensory or phasic language disorders are observed before the onset of the headache. These different symptoms can occur simultaneously. A few years ago, migraines with visual aura were nicknamed ophthalmic migraines, but this expression is no longer used. Causes. The visual aura is a neurological phenomenon and not an ocular one. It is linked to the activation of certain neurons in the cerebral region responsible for vision, located in the posterior cortex. This abnormal activation triggers the appearance of light spots, sometimes described as flashes or kaleidoscopic vision, during which vision is blurred. These signs are called scintillating scotomas. There is certainly a genetic component, since several members of the same family can suffer from it. However, no gene has yet been identified, indicates Dr. Caroline Roos, neurologist and head of the Headache Emergency Center at the hospital. Lara Boisier, a PhD. Migraine patients would therefore have a brain predisposed to seizures. A susceptibility that makes them more vulnerable to multiple triggering factors such as the alcohol, sudden changes in brightness, hormonal variations, lack of sleep, emotional changes, headache symptoms and duration. Migraines with aura are characterized by the appearance of visual scintillating scotomas, loss of vision, sensory tingling, tingling around the mouth and/or phasic language disorders. These auras precede the migraine headache, which manifests as a headache often affecting only one side of the skull and felt as throbbing. It is accompanied by an intolerance to light and noise, as well as nausea and vomiting. This violent headache, aggravated by everyday actions such as climbing stairs, can last from 4 hours to 3 days. Diagnosis. Should an MRI be done? To diagnose a migraine, with or without aura, the doctor relies on the symptoms described by the patient as well as clinical examinations, particularly neurological ones. Imaging examinations (MRI) are not necessary because this disorder cannot be explained by the existence of a lesion. The diagnosis of migraine with aura is based on at least 2 of the following 6 criteria: presenting one of the neurological symptoms known as positive symptoms, the progressive installation of the aura, the succession of the different symptoms, the duration of the aura must be between 5 and 60 minutes, be unilateral, followed or be accompanied by a headache, explains the neurologist. Treatment. What to do in case of migraine. The treatment of migraine is based on the eviction of the triggering factors as far as possible, the treatment of the crisis and the basic treatment. The effectiveness of the crisis treatment depends on its precocity. The earlier the patient takes his treatment, the faster the crisis will be relieved. The patient is advised to take 1 gram of aspirin at the time of the aura or a non-inflammatory anti-inflammatory steroid drug NSAIDs to limit the duration of the aura and prevent headache, says Dr. Roos. If the headache still occurs, patients are advised to take the classic treatment for migraine, triptans, which act on specific receptors in the brain. They can be combined with NSAIDs. However, the doctor will insist on the risks of abuse and will remind patients that NSAIDs should not be taken more than 15 days per month and triptans not more than 10 days per month. When this crisis treatment is no longer effective enough or when patients have frequent migraine attacks, doctors can offer a disease-modifying treatment. This is based on the daily intake of 1 gram of aspirin or amitriptyline, an antidepressant. In the most severe cases, we can offer drugs that are not initially intended for migraine, such as antiepileptics or certain antihypertensives, describes Dr. Roos. Non-pharmacological approaches have also been proven to relieve patients, such as relaxation sophrology methods and cognitive behavioral therapies that help to better manage stress. On the other hand, the techniques of chiropractic, osteopathy or even homeopathy have not demonstrated their effectiveness. As a general rule, ophthalmic migraine attacks require the patient to rest, if possible in total darkness.